Hey, what's up everybody, and welcome back to Morgellons discussion and microscopy videos. I'm your host Jeremy Murphy, and today I'm just jumping on here real quick to wish everybody a happy new year and to give you some updates about what's been going on recently in the world of Morgellons. First of all, I want to thank everybody for stopping by morgellonssurvey.org and taking the new Morgellons survey. We do have a lot of responses, and that data is going to help patients prevent getting Morgellons or developing Morgellons, and hopefully to get better treatment going forward. The second thing is, on the Morgellons course, thank you to everybody who has recently signed up, and especially those who have made it all the way through the course to the very end. I want to remind everybody that when you're on that last section of the course, you have to hit the complete. That's the section where it's showing you the certificate. That would be the sixth section. Make sure to hit complete at the top right to let me know that you've completed the course, and then I can print you off a certificate and email it to you. Those are going to be changing because I've got to update my signature on it. But more and more people are signing up because they want to learn the scientific truth about Morgellons. So the fourth thing I want to talk about is the ICliniq article on Morgellons that recently was published about December 27th. This is a classic example of why professionals can't get Morgellons right. They've got the idea in their head that Morgellons is delusional, and that's not the case. There are some patients who could mistakenly believe they have Morgellons based on misinformation they've seen on the internet, but there are patients who really do have Morgellons, like myself, and you if you're watching this with me. And we need responsible treatment. And in order for that to occur, the relevance of the bacterial infections associated with Morgellons and the patients who really have it need to be responsibly addressed. And that can't occur with antipsychotics or antidepressants. You can't treat Lyme disease with those agents. You have to use antibiotics. And what we're finding now is that a combination of them seem to be more effective than just using a single antibiotic in general. So there's a lot of, it's not the CDC, is not the reason why Morgellons patients can't get treated. It's because of your local state governments. You know, they're the ones, the medical agencies and the medical associations in your state that determine the education for practitioners and how they have to be accredited. They're the ones that need to take the step in going, okay, even though Lyme disease isn't considered endemic in our region, and even though we don't want people to think that there's syphilis going around, we need to update our education so that our practitioners know what to look for. Because right now they're looking at it and they're going, oh, this person needs to be on antipsychotics, and that's just the wrong way to treat this condition. So along with the Morgellons course that we have for the average individual who may be going through it or know somebody and care about somebody who's going through it, we're also working to develop a course for practitioners so that they can see what Morgellons is and know whether or not the patient really has it or if they just mistakenly believe they have it and what steps to take along that way. And it's pretty much all put together. We just got to finish putting it together. It'd be nice if we had a sponsor too. But getting back on the list here, Morgellons fibers don't move. They just don't move, and hexagon crystals are not relevant to Morgellons. We've talked about this several times, but this goes back to the understanding of the literature. Morgellons is very real, but some aspects of the lore that's been propagated through online misinformation are not. And included in those are moving Morgellons fibers. Morgellons fibers don't move. And hexagon crystals, those most often come from cosmetics or greeting cards. And you just have to read the research to understand that. ICliniq, they tried their best, but they just, at the end of the day, they made the conclusion that Morgellons is a delusional state, and that's not what the sources they've cited state. So you have to really make time to go through and read not only the research, but the sources that are cited in it, and then keep reading it month after month. Go back and review it. That's one of those things about understanding things, is that often your perspective evolves based on your understanding of everything else associated with the topic. And that's where you have to go into the sources that are cited in that research and understand what they're trying to say and understand the research in context. And when you do that, you'll realize that Morgellons fibers don't move, and there's no such thing as hexagon crystals in regards to Morgellons being significant. The last thing is Lyme disease testing and why it could fail. And one of the reasons is because the body may not produce antibodies which would reveal themselves on the Lyme disease test. The second reason, of course, would be because the patient has a strain of the Borrelia bacteria besides Lyme disease, specifically, like me. I've got the tick-borne relapsing fever, and that has resulted in my Morgellons skin condition. But there are other strains that we don't have tests for, and again, the body may be impaired by the infection itself from producing specific antibodies that would reveal themselves on those serologic screens. That happens the later you go through an infection without being adequately treated. You know, if you're getting a couple of weeks of antibiotics every few months to try to get your sores to clear up, that's just going to allow the infectious colonies inside your body to learn how to address those therapies and interventions. So yeah, that movie just came out, the Why Am I Still Sick? The Silent Role of Biofilms in Chronic Diseases, and it's freely available on YouTube right now. I'm going to include a link in the description below. I've got a lot of things going on here. I'm doing some new work. I'm doing a lot of work with patients with the Lyme disease, because that is a common thing. A lot of patients, when they do get a positive test, that doesn't mean that it's a false positive. It's a good sign that patient has been exposed to Lyme disease. And going through treatment for Lyme disease is a different animal. You know, you're not just going in there for 2 weeks of antibiotics and praying the sores don't come back in a couple months. You really have to treat it aggressively and responsibly, because the later it is allowed to persist and the more exposures you've had over time, the more agents are going to be added to those microbial colonies. And that's what Why Am I Still Sick? The Silent Role of Biofilms in Chronic Diseases talks about how medical professionals, including those who work at the CDC, understand about biofilms and about these polymicrobial colonies. And you should understand that too, and you can by watching this ad-free film, Why Am I Still Sick? The Silent Role of Biofilms in Chronic Diseases. Hey, I hope everybody's having a great 2023. You know, it's a year. Last year was tough, man, but we're just going to keep on going and see what happens. Okay, so on a, what do you call it, a postscript? Is that what you call it, the PS? Ivermectin can be repurposed, and it can be taken routinely in a regimen that a doctor recommends for treating your late-stage persistent Lyme disease. We do know that filarial nematodes are considered a co-infection of Lyme disease. About 30% of the ticks they rounded up for this study found that they had the little worms, microscopic worms, inside the guts of these ticks. And often when you get bit by a tick, they can shoot some worms up into you, and those worms can propagate inside your body. So don't let that shit happen to you. If you like this video, go ahead and drop me a like. Thank you for staying subscribed, and especially those who are supporting me financially. We are going to go for that 501c3 for the new Morgellons movement back here. I have people together, but we are not organized yet. We do want to take that next step and become an actual charity. You can donate to us and then write off those donations, but we're just not quite there yet. Let me know what you guys think about this video. Drop a comment in the discussion down below. Hope everybody's having a great 2003 and everything's working out good for you. Take care, and we'll see you soon.